Good day, I am Isling Del Rosario from BSN 111B Group 6. Today, I will perform an assessment of the cardiovascular system return demonstration. Assessing the cardiovascular system is essential to identify any signs of heart disease and initiate early referral and treatment. For the pre-introductory phase, first, review the client's previous medical records and doctor's order sheet if available. Previous medical records will help us in understanding the current health status of the patient and to verify the order with the doctor's order sheet. Next is to determine the scope of the assessment needed. So in this assessment, complete examination of the cardiovascular system consists of inspection, palpation, and auscultation of the neck, anterior chest area or the precordium, and the upper and lower extremities of the body. Also, we must prepare all the materials needed for us to work systematically and efficiently. The materials needed are first, the pen light, to be used as the tangential lights alternative. Next is a rectangular cord and a centimeter ruler to measure the patient's jugular venous pressure. And of course, a stethoscope to auscultate the heart sounds. Then perform hand washing before and after the procedure to avoid the spread of microorganisms. Good day, sir. I am Isdimay Del Rosario, a student nurse from Davao Doctors College Incorporated. So as you can see, I already closed the door to ensure your privacy. Okay, so for verification, sir, may I know your full name, please?
My name is Genesis Del Rosario,
Okay, how about your birthday?
May 21, 2003.
Okay, so how would you like me to call you?
Genesis.
Okay, so Genesis, may I know how are you doing today?
I'm doing good.
Okay, Genesis, today I am going to assess your cardiovascular system, which means I will be inspecting your chest and neck area. I will also be palpating your pulse, and of course, I will be auscultating or listening to your heart sound. So is that okay with you?
Yes.
Okay, so do you have any questions or clarifications regarding the assessment today?
No.
Okay, so rest assured that all the data gathered in this procedure will all be kept confidential, okay? So before we start, may I ask if you're comfortable with your seat?
Yes.
How about the temperature? Do you want me to adjust the temperature?
No.
Okay, so if you feel uncomfortable or if you have any questions during the assessment, feel free to tell me, okay?
Yes.
Okay, so before I proceed with the assessment, I will be asking some questions regarding your health history, okay?
Yes.
Okay, so what brings you here today, Genesis?
I feel chest pain.
Oh, so you're experiencing chest pain. Can you describe to me your chest pain? Is it stabbing, burning, or is it squeezing?
It's squeezing.
Okay. So when did this chest pain start?
A month ago, pero abi na ko wala lang, mawala. Wala ko ning konsulta sa doktor.
So where do you usually feel the pain?
In my left chest.
Okay, so can you point it to me?
Here.
Okay. So does it radiate to other areas?
Yeah, day to my left arm.
Okay. So how long does the pain last?
10 to 1 hour.
Okay. So on a scale of 1 to 10, with 10 being the most painful and 1 being the least, how will you rate your chest pain?
6.
6. So aside from your chest pain, do you experience any other symptoms?
I feel dizzy, difficulty in breathing, palpitation. Kasi palagi akong umiinom ng kape. Kaya akala ko normal lang.
Okay. So have you been diagnosed with a heart disease before?
No.
Okay. So have you ever had heart surgery before?
No.
Okay. So is there a history of any heart diseases in your family?
No.
Such as myocardial infarction? How about coronary heart disease?
No.
Elevated cholesterol level?
No.
Or diabetes mellitus?
No.
So none?
Yes.
Okay. So about your lifestyle, you mentioned earlier that you always drink a coffee, right?
Yes.
So how many cups of coffee do you usually consume on a daily basis?
4 times a day.
Okay. So what type of stress do you have in your life?
Schoolwork kasi ang daming gawain.
Okay. So how do you usually cope with your stress?
Nanonood ng TV, lumalabas at naglalaro ng cellphone.
Is there anything more?
Mahilig ako kumain ng fatty foods at oily foods.
Okay, fatty foods and oily foods. Okay. So I think that's it for our health history taking. So let's proceed with the physical examination of your cardiovascular system, okay? In assessing the jugular veins, stand at the right side of the patient to have easy access to the patient's jugular veins. Then, the patient should be in a supine position with the torso elevated 30 to 45 degrees. And make sure that the head and the torso are on the same plane. Then ask the patient to turn the head slightly to the left or away from the side being evaluated. And shine a light into the neck suprasternal notch, and the area around the clavicles. In my case, I am using a pen light. This is to increase visualization of pulsations and shadow around the neck. So Genesis, can you turn your head slightly on your left? So, okay. Since I observe a distended jugular vein, I will assess for the jugular venous pressure by locating the highest visible point of distension of the internal jugular vein. So using the pen light, I will observe for distension, protrusion, or bulging. Raise or lower the head of the bed into 30, 45, 60, and 90 degrees until the highest visible point of distension of the internal jugular vein was observed. Make sure that at each increase of the elevation, have the patient's head turned slightly away from the side being evaluated. Can you please turn your head slightly on your left? Okay. Then, after locating the highest visible point of distension, measure the vertical height of this point in centimeters from the sternal angle, extending a long rectangular object or card horizontally, making an exact right angle. Okay, make sure to repeat these steps on the other side of the neck. Okay, so can you please turn your head slightly on your right? Okay, so I'm just inspecting your suprasternal notch, your jugular veins. Okay. Okay, so I observed that your jugular veins in both the left and right are visibly distended, and upon measuring your venous pressure, I observed that you have a central venous pressure of 3 cm, which is considered to be abnormal. In assessing the carotid arteries, position the patient's head of the bed 30 degrees slightly elevated, and instruct the patient to look slightly towards the side being examined. This makes the carotid artery more accessible. Since I am going to examine the right area first, the patient must look slightly towards his right. Then afterwards, palpate the patient's carotid artery lightly to avoid occluding the artery. Make sure to palpate the carotid arteries individually to ensure adequate blood flow through the other artery to the brain. Okay, Genesis, can you look slightly towards your left, please? I mean towards your right. Okay, so I am going to palpate your carotid artery, okay? Okay, can you look to your left, please? I am going to palpate for your carotid artery, okay? Okay. Now that I'm done palpating my patient's carotid artery, I will now auscultate it. So instruct the patient to turn his head slightly away from the side being examined. So this facilitates placement of the stethoscope. Then ask the patient to hold his breath while you are auscultating the carotid artery so that breath sounds do not conceal any vascular sounds. Then, listen for the presence of a bruit or the blowing or swishing sound that is caused by a turbulent blood flow through a narrowed vessel. Then if you hear a bruit, gently palpate the artery to determine the presence of a thrill. Okay, Genesis, now I am going to auscultate for your carotid artery. So while I am auscultating for your carotid artery, can you please hold your breath for me, okay? Okay. So can you please turn slightly on your left? And then inhale, exhale, then hold your breath. Okay, on the other side. Okay, inhale, exhale, then hold your breath. Okay. Okay, upon palpating your carotid arteries, I can feel a strong bounding pulse, which is rated as 4 plus in the pulse amplitude scale. This pulse is considered to be abnormal finding. Furthermore, while auscultating your carotid arteries, no blowing or swishing sound are observed. However, I can hear a bounding fear pulse in both your left and right carotid pulse. Okay. Okay. Now I will proceed with your anterior chest or precordium. So I am going to start with inspection and palpation of your anterior chest or precordium. Okay. Okay. Now, I will proceed with the inspection and palpation of the chest area. To start this procedure, begin with a general inspection of the chest. Same as the previous procedure. Stand at the right side of the patient with the patient in a supine position with the head of the bed elevated 30 degrees and look for any abnormal pulsations. Lift or heaves, which is a strong outward thrust of the chest. Then shine a tangential light across the chest wall to make these movements visible. Okay, I'm just observing your chest. So I'm going to light. Okay. While inspecting the precordium for pulsations, palpate the aortic area, pulmonic area, tricuspid area, and the apical area. In palpating for heaves, use the palm or hold fingertips obliquely against the chest. So, Genesis, I'm going to palpate, okay, your chest, okay? So, the right second intercostal space here, near the sternum is what we call the aortic area. Then here on your left second intercostal space, near the sternum is your pulmonic area. And here on the fifth intercostal space near the sternum is where your tricuspid area. And lastly, I'm going to palpate for your apical area here in the fifth intercostal space mid-clavicularly on your left. Okay. In palpating for thrills, press the ball of the hand firmly on the chest to check for a buzzing or vibratory sensation which can indicate a loud heart murmur. Okay, so I am going to palpate again your chest area, okay? Okay. Now, I am going to palpate for impulses using my fingertips flatly on the aortic area, pulmonic area, and tricuspid area. So, I am going to palpate again, okay? Starting with your aortic area, pulmonic area, and your tricuspid area. Okay. Now, palpate for the apical impulse. Use the palmar surface of 2 to 3 middle fingers to palpate for the apical impulse of the apical area located at the left fifth intercostal space mid-clavicular. So I am going to palpate your apical area, okay? Okay. For finer assessment, palpate with one finger only to confirm characteristics of the apical impulse for location, diameter, and amplitude. So I'm going to palpate again, okay? Okay, so if the apical impulse cannot be palpated with the patient supine, you can reposition the patient to lie on his left lateral side. This is to displace the heart towards the chest wall and relocate the apical impulse. Then palpate again using several fingers. So Genesis, can you please roll on your side? Okay. Then I am going to palpate for your apical impulse, okay? Okay. So if the apical impulse is still unable to palpate, you can ask the patient to exhale fully and stop breathing for a few seconds while you are palpating the patient's apical impulse. So Genesis, what I want you to do is to exhale fully and hold your breath while I am palpating for your apical impulse, okay? Okay, you can on your side. So inhale, then exhale fully, then hold your breath. Okay. Now, I am going to inspect and palpate at the epigastric area at the base of the sternum for any signs of abdominal aortic pulsations. So, I am going to inspect in your epigastric area, okay? Okay, so I am going to palpate, okay? Okay, so I am going to auscultate your anterior chest, okay? Okay, so now, I will auscultate for the heart rate and rhythm. So by doing that, place the diaphragm of the stethoscope at the apex of the heart, here at the left fifth intercostal space mid-clavicularly, then listen to the rate and rhythm of the apical impulse. Count the heartbeat for a full minute. Okay, so I am going to auscultate now your apical impulse. Okay. Okay, so I observed that your heart rate is 100 beats per minute, meaning you have a tachycardia. I also observed that you have an irregular rhythm, which means I will be assessing for your pulse deficit, okay? Okay, assessing pulse deficit is usually done by two nurses, where the nurse will be palpating for the radial pulse, while the other nurse will auscultate for the apical pulse. So this is done to minimize inaccuracy in counting the pulse. However, in my case, I will be palpating the radial pulse and auscultating the apical pulse at the same time for a full minute, after which the difference between the apical and the radial pulse will indicate the result of the pulse deficit. May I have your hand, please? So I am going to palpate for your radial pulse, and at the same time, I will be auscultating your apical pulse, okay? Okay, I observe that there is a difference of 4 beats from your apical pulse and your radial pulse. So this usually indicates abnormalities, okay? Next, I will be auscultating the heart in all 4 anatomic sites, namely the aortic area, pulmonic area, tricuspid area, and apical area. So I will use the diaphragm of the stethoscope first to listen for the high-pitched sounds, and then afterwards I will be using the bell for the low-pitched sounds. So while auscultating, I am listening for the heart sounds, the S1 and S2, also for extra heart sounds and murmur. So ask the patient to breathe regularly since breath holding will cause any normal or abnormal split to subside in the heart sounds. Okay, now Genesis, what I want you to do while I am auscultating in your chest area, I want you to breathe regularly, okay? Okay. So I'm going to use first the diaphragm of the stethoscope to listen for high pitch sounds, okay? I'm gonna start here in your area. Okay, now I'm going to use for the bell side of the stethoscope to listen for low pitch sounds, okay? Okay. Okay, then repeat these steps while the patient is in left lateral position, then at the sitting position, leaning forward, and briefly stop breathing after exhalation. So Genesis, what I want you to do is to roll on your left side. Then I am going to auscultate again your chest, okay? So what I want you to do is to hold your breath, okay? While I am auscultating in your chest area, okay? Okay, so inhale, exhale, then hold. Okay, on the other side, inhale, exhale, then hold. Okay, on the other, okay, inhale, exhale, then hold. Okay, inhale, exhale, then hold. Okay, so I'm going to listen. I'm using the bell again. Okay, so I want you to roll on your left side again. And then inhale, exhale, then hold. Okay, on the other side, inhale, exhale, then hold. Okay, then inhale, exhale, then hold. Okay, again, inhale, exhale, then hold. Okay, now what I want you to do is to sit down. Okay, sit down. Okay, then lean yourself forward. Okay, so I am going to auscultate again your chest area, okay? Inhale, exhale, then hold. Okay, inhale, exhale, then hold. Inhale, exhale, then hold. Inhale, exhale, then hold. Okay, now I'm going to use my bell, okay? Okay, so inhale, exhale, then hold. Okay, on the other side, inhale, exhale, then hold. Inhale, exhale, then hold. Inhale, exhale, then hold. Okay, you may lie down now. So I observed that there is an increased intensity in your heart sound, specifically here in your pulmonic area. I also observe irregular rhythm, and your heart rate is 105 beats per minute, which means that you have tachycardia. Furthermore, I can also hear some high-pitched blowing murmurs with an intensity graded as 3, which is moderately loud here at your left second intercostal space. So all of these findings are considered to be an abnormal. So now I will be examining your upper and lower extremities, starting with your upper extremities, okay? So to start this procedure, I will be observing the arm for its size, symmetry, skin color, and temperature from fingertips to shoulder. I will also note for any presence of edema, vision, skin texture, and skin distribution. Okay, so may I have your arms, please? Okay, so I am just inspecting. Okay, on the other side. Okay, so I am going to assess for temperature. Okay, on the other side. Okay. Now, I will be inspecting for the peripheral veins in the arms for the presence of superficial veins when the limbs are dependent or the hand is lower than the heart level, and if the limb is elevated or the hand is higher than the level of the heart. So, I'm going to inspect again. Okay, on the other side. Okay, Let's elevate your hand. Okay, now I will be palpating for the radial pulse located at the wrist, ulnar pulse here on the medial aspect of the wrist, and the brachial pulse here in the antecubital area. Okay, so I'm going to palpate first for your radial pulse, okay? Okay, now I'm gonna palpate for your ulnar pulse. Then now is for your brachial pulse. Okay, on the other side, please. I'm gonna palpate first for your radial pulse. And then ulnar pulse. And then your radial, and then your brachial pulse. Okay, now I will assess for the capillary refill by compressing the nail bed and releasing the pressure and calculating the time it takes to for the color to return into pink tones. So may I have your fingers, please? Okay. Okay, on the other arm, other hand. Okay, now I will be performing the Allen test. So Allen test is used to evaluate the patency of the radial and ulnar arteries. So in conducting the test, have the client rest the palm of the hand side up and instruct the patient to make a fist. So Genesis, can you please make a fist like this? Okay. And then, using your thumb, occlude the radial and ulnar arteries at the same time. Continue to occlude both the arteries and instruct the patient to release the fist. Okay. So can you release your fist now? So release the pressure on the ulnar artery first and watch for the color to return to the hand. Now for the radial artery, instruct the patient to make a fist first, to make a fist. And then occlude, using your thumb, occlude the radial and the ulnar artery. Okay, do the Allen test on the other side, on the other hand. Okay. Can you make a fist? And then release your hand. Okay, so I'm going to do it again. So can you make a fist? Okay, you may release your hand now. Okay, so as you can observe, I conduct the assessment on both sides at the same time. This is to compare the both sides of the patient's arms simultaneously with the patient in a supine position, assess for the leg size, symmetry, skin color, and temperature from the groin to toes. Also, note for any presence of lesion, skin texture, and hair distribution. So I am just going to observe your legs. Okay. Going to palpate to assess for the temperature. Okay. Now, I am going to inspect for the peripheral veins in the legs for the presence of superficial veins when the limbs are dependent and when the limbs are elevated. Okay. So I'm just inspecting for superficial veins. I am going to lift your leg, okay? Okay, on the other side. Okay. Next is to palpate for the femoral pulse below the medial to the inguinal ligament, then the popliteal pulse located behind the knee, the dorsalis pulse located at the dorsum of the foot, and the posterior tibial pulse behind and below the medial malleolus. So now I am going to palpate first the femoral pulse. So I am going to palpate your femoral pulse, okay? Can you please bend your knee? Then move it outside. So I'm going to palpate now, okay? Okay. Now I will be palpating for your popliteal pulse. So can you please raise your legs partially? Okay, on the other side, can you raise it? Okay. Now I'm going to palpate for your dorsalis pedis pulse, okay? So I am going to dorsiflex your legs, your feet. Okay? Okay. Okay, lastly, I am going to palpate for your posterior tibial pulse, okay? So can you move it sidewards? Okay. Now, I will be assessing for any signs of ulcerations, varicosities, and thrombophlebitis in the peripheral leg veins. Okay, so I am going to inspect your calves for any ulceration, varicosities, or thrombophlebitis. Okay, now I am going to palpate the calves for firmness or tension of the muscle and if there are any signs of edema on the dorsum of the foot. I'm going to palpate now. So there are no signs of tenderness, no edema. Okay, now I will firmly dorsiflex the patient's foot while supporting his entire leg in extension. So this assessment is called the Human's test. Okay? So I am going to dorsiflex your foot, okay? And then I am going to palpate your calves, okay? Okay, dorsiflex. Okay, on the other side. Okay. Now I will assess for capillary fills in both legs. So that's it for a physical examination. So how are you feeling now that we're done with your physical examination?
I feel good.
Okay, so are you comfortable with your seat right now?
Yes.
Okay, so now I am going to summarize all the information I obtained during our physical examination. Okay, upon assessing for your jugular veins, I observed that both the left and right jugular veins are visibly distended. Your jugular venous pressure is about 3 cm in both the left and right, which is considered to be abnormal. Okay, for your carotid arteries, I can feel a strong bounding pulse, which is rated as 4 plus in the amplitude scale. Furthermore, while auscultating your carotid arteries, no blowing or swishing sounds are observed. However, I can hear a bounding firm pulse in both the left and the right carotid arteries, which can indicate abnormality. Okay? Okay, for your apical impulse, I observe that your apical impulse feels like a gentle tapping, which can be considered normal. Okay? For the epigastric area, I don't observe any bounding abdominal pulsation, which is a good thing. However, I can feel a pulsation or heaves here at your pulmonic area or at the left sternal border, which can be an abnormal finding. Upon auscultating your precordium, I observe that you have tachycardia and an irregular rhythm in your heart rate. And so I assess for your pulse deficit. And I observe that there is a difference of 4 beats from your apical pulse and radial pulse, which is considered to be an abnormal finding. Okay? Furthermore, I also observe that there is an increased intensity in your heart sounds, specifically in your pulmonic area. And I can hear some high-pitched blowing murmurs with an intensity graded as 3, which is moderately loud here at your second intercostal space. Okay? For your upper extremities, I observe that your arms are bilaterally symmetric. No edema or prominent venous patterns are observed. Skin is warm to touch. So radial, ulnar, and brachial pulses are within the normal range and it has a regular rhythm. Okay? Okay, capillary bed refill is also good and the results of your Allen test is also normal. Okay, for your lower extremities, legs are symmetric in size, skin is warm to touch, hair is distributed evenly, no signs of edema, lesions, or ulcers. Okay, your pulses in femoral, popliteal, dorsalis pedis, and posterior tibial are all considered to be normal findings. Okay? Okay, no ulcerations, varicosities, or thrombophlebitis are observed. Okay, so lastly, capillary refill and Human's test are all considered to be normal. So all of this information will proceed to the physician. Okay? So right now, I can demonstrate some stress management behavior. So since you have said earlier that you are stressed lately, you can listen to calming music or exercise slow or deep breathing to decrease the level of your stress since stress is a possible risk factor for heart disease. Okay?
Okay.
I also suggest limiting your fatty and oily foods intake as what you have mentioned earlier, okay?
Okay.
Since elevated cholesterol level increases the chance of fatty plaque formation in the coronary vessels. So I think that's it. So do you have any questions or clarifications before we end?
No.
Okay, so we will just call you for further assessment in the future, okay?
Okay.
Okay, so thank you very much, Genesis, and have a good day.